All right, so next up, nitrates, generally sublingual 0.3, 0.6 times 3. If patient's having refractory chest pain, you can start nitro drip at 5 to 10 mics per minute. Nitro paste and nitro drip have shorter half-life than the sublingual, and it's important to know there's no mortality benefit to nitrates. It's only symptom reduction. Also important to know to avoid in patients with inferior MI, like right ventricular MI or hypotension, systolic blood pressure less than 100. If patients having refractory chest pain, having to start nitro drip, it's an indication for an earlier cath in patients with NSTEMI or unstable angina. Anticoagulation, most commonly heparin. It's usually stopped after 48 hours if ECG change is improving and there's no concern for ongoing ischemia. It's important to start drip with bolus and use low intensity PTT goal. So that's usually the cardiology dose. Heparin, PTT goals between 63 and 83. Next up, we have low molecular weight heparin. Or therapeutic Lovenox, possible reduction in death with minimal evidence for increased major bleeding. And we have trials that compare versus heparin that are largely null. So, one or the other is generally same outcomes. We also have GP2B and 2A inhibitors like integralin, less used. This can be initiated in the cath lab if PCI is high risk. And we have bivalirudin, direct thrombin inhibitor. This is preferred with patients with HIT. Otherwise, cost does not outweigh the benefits, so generally more expensive medication. Beta blockers. It's important to start within 24 hours. Although recent evidence still ongoing for the mortality benefit in beta blockers post ACS. However, as of now, it's important to consider early initiation for ischemic arrhythmias. Not indicated for stable ischemic heart disease after cath, but recommended after CABG. Always important to caution initiation of beta blockers in decompensated HFpEF, as it's been shown to increase risk of cardiogenic shock, especially in patients greater than 70 with hypotension or heart rate that's greater than 110 or less than 60.